Bienvenidos a todos. Mi nombre es Miguel Lovato de la Fundación Donald K. Hoy hablaremos sobre nuevas formas de asegurar que los niños en cuidado de familiares, amigos y vecinos sin licencia tengan acceso a comida saludable. Welcome, everyone. I'm Miguel Lovato with the Donald K. Foundation. Today, we'll explore new ways to make sure kids in license-exempt, family, friend, and neighbor care get healthy food. Esta reunión será en inglés con interpretación al español proporcionada por la Cooperativa de Lenguaje Comunitario. This meeting will be in English with Spanish interpretation, provided by Community Language Cooperative. Permítanme presentar a Alejandro Arrieta, quien nos guiará sobre cómo usar la función de interpretación en Zoom. Let me introduce Alejandro Arrieta, who will guide us on using Zoom's interpretation feature. Alejandro?
Awesome. Thank you very much for having me, all. My name is Alejandro. I will be your English-Spanish interpreter in this space. I'm going to go ahead and provide instructions in Spanish first, and then I'll come back and repeat them in English in just a moment. Hola a todos, gracias por tenerme aquí con ustedes. Mi nombre es Alejandro Arrieta, seré el intérprete del inglés y del español en este espacio. Queremos practicar la justicia del lenguaje lo más posible, por lo tanto queremos que cada persona pueda participar en el idioma de su preferencia o en el idioma de su corazón, como decimos, ¿no? Entonces, después de estas instrucciones, van a ver un icono terráqueo aparecer en la parte inferior a mano derecha en su pantalla. Es como un mundo. Al menos que han ingresado a la junta usando un dispositivo móvil, tal como celular o tableta, en cual caso verá la opción de la interpretación bajo el menú con los 3 puntitos que dice más. De ambas maneras podrá usar la función de la interpretación para seleccionar el español y poner el audio original en silencio si usted cree que es necesario para usted. ¿Va? Si tiene algún problema con la interpretación en algún momento, por favor avísenos en los mensajes de chat y haremos todo lo posible por remediar ese problema. Voy a repetir esto en inglés y de ahí prendemos la interpretación y les regreso su tiempo para comenzar. All right, so thank you for your patience as I provided those instructions in Spanish first. Again, we do want to work towards language justice as much as possible in this space, so thank you to our hosts for doing so. That does indicate to us that every person should be able to fully engage in the language of their preference or in the language of your heart is like what we like to say. So after these instructions, not quite yet, but afterwards, you're going to see a globe icon appear on the bottom right-hand side of your screen. Once you see that, make sure you go ahead and click on it for interpretation. If you have joined on a mobile device, such as a tablet or a cell phone, you'll see the interpretation option under the 3-dot menu that says more. But either way, once it pops up for you, make sure you go ahead and click on it and select English as your preferred language if you are not fluently bilingual in both languages, English and Spanish. But yeah, and with that, I'll go ahead and pass it back over to our host to turn on the interpretation. Ya vamos a aprender la interpretación, and we can get started.
Gracias, Alejandro. Thank you, Alejandro. Give a second for everyone to find the globe. All right. Well, again, welcome. Voy a hablar en inglés for this next part here. And let me tell a little bit about why we are here and why we're hosting this here today. We want to understand more about this federal food program called the Child and Adult Care Food Program. And specifically, we want to understand how states other than Colorado have unlinked or delinked or decoupled eligibility for this federal food program, CACFP, from eligibility for child care assistance programs like Colorado's Colorado Child Care Assistance Program, or CCAP. And before we begin, I'd like to ask all of you to please place your name and organization or community affiliation in the chat. We're very happy with the turnout that we have here today. Also want to note that the meeting is being recorded. We will share the recording and the slides via email after the meeting. And given the number of participants we have here today, we ask that everyone remain on mute. Allow me to go ahead and let's get into our presentation. And I would like to introduce the Senior Fellow at the Center on Labor and Human Services and Population at the Urban Institute. Gina Adams was the lead author of the report Untapped Potential, License-Exempt Home-Based Child Care Providers and the Child and Adult Care Food Program. Gina, thank you for joining us today. I'm going to turn it over to you.
Thank you so much. Muchísimas gracias, Miguel. I do speak Spanish, but not well enough to do this presentation. So I'm very thankful for Alejandro to be here to help. I have asked Alejandro if I speak too fast to let somebody know to interrupt me, and I am happy to be interrupted and slow down. But I am really delighted that this is being translated simultaneously. So thank you very much, Miguel and Tabor and everybody for doing that. I'm going to share my screen, and we're happy to make these slides available to you afterwards. Let me just pull this up. Can everybody see that okay? Are we good?
Yes.
Okay. So this is, as Miguel mentioned, this is a report that we wrote called Untapped Potential, License-Exempt Home-Based Child Care Providers and the Child and Adult Care Food Program, long title. I wrote this along with my colleagues, Catherine Coons and Fernando Hernandez Lepe, who's on, well, hopefully I think are with us today as well. What we did, and I want to share with you today is kind of, first of all, why we did this study. Second of all, a little bit about the context, because I think it's complicated and important to understand why this is so important. Then tell you what we learned in our study, and then talk a little bit about the implications for policy. First of all, why we did this. So food insecurity, I'm assuming that all of you know this, but affects 1 in 8 children nationwide. And that includes about 130,000 children in Colorado. That's the most recent numbers I found. If somebody else knows differently, please put that in the chat. The Child Adult Care Food Program, CACFP, can make a difference. It's been shown to affect household food insecurity, to affect children's long-term outcomes. It's a very effective strategy. As I'll show you in a minute, there's actually more children in these kinds of settings, what we call license-exempt home-based childcare settings, than there are unlicensed. Now, this is a complicated term. We use this one because it's kind of the legal term that works every place in the country, but you all, I think in Colorado, call these FFN. Some people call them informal care providers. There's lots of different names, but we're going to use this silly acronym of LEHBCC, or licensed exempt providers. But despite the fact there's more children, as I'll show you in a second, in these settings than in licensed care, most states don't allow them to participate, or if they do, there's lots of constraints in how they can participate. So what we wanted to do with this study was, what could we learn from a few of the states that did do this to help bring lessons to other states like Colorado? Their funding was from the Robert Johnson Foundation. We first talked to some states that did not allow this to make sure that we understood their questions. We then just chose 3 of the states that did allow, and that was Illinois, Louisiana, and Oregon. Those are just 3 of them. We spoke to state child care food program agencies, other agencies that were involved in approving providers, sponsor agencies, staff, other stakeholders, national experts, to kind of understand how it worked. We then shared our results with experts from those communities to make sure that we were getting it right. I want to say 2 big caveats that we have. One is, despite our best efforts, we spoke with very few providers. It turned out to be very hard to do. We decided it needed a study in and of itself. So it's a very important missing perspective that we feel like needs to be addressed. And second, we only talked to a few of the sponsor agencies in each state. So we do not know that we have a statewide perspective, but we did have insights that we can share. So first, understanding the context. This is the first one that I mentioned a minute ago. In 2019, in the blue bars, the dark blue are children in licensed childcare centers. The light blue is children who are in what they call listed, which is home-based childcare providers, is basically licensed family childcare providers. So the blue altogether is children in licensed programs, and you'll see that there's about 9.5 million in licensed centers, 785,000 in licensed homes. So that makes about 10.5 million kids. The yellow bars are what's interesting here, and honestly, this surprised me a little bit. We see that the dark yellow, 3.5 million about, are children who are in paid, unlicensed home-based settings. And the light yellow, the 8 million, are children who are in unpaid, unlicensed home-based settings. So you can see that if you put those together, that's 11.5 million children in unlicensed home-based settings compared to 10.5 in licensed settings. I'm saying that because the blue is where most of the CACFP money goes. The yellow is what we're talking about today. So it's really important to understand that we're talking about a lot of children nationwide. The second context piece to share is that states vary all over the map in terms of how many kids you can serve in a home before you have to be licensed. In Colorado, it's serving, you can serve up to 4 kids as long as only 2 of them are under 2. But it's all over the map. So you'll see on this graph, the first bar is that there are 10 states that say the minute you take care of one child who you're not related to you, you have to be licensed. 5 states say 2 kids unrelated to you, you have to be licensed. 8 states say 3, 11 states say 4. You can see how it goes, right? Most states exempt families who are relatives only. If you're just caring for relative children, depending on how the state defines it, they're exempt. But you can see this means that the size of that yellow bar is going to be very different from one state to another, right? In a state that only exempts the 1, that means it's just relative caregivers in those first 10 states that are going to be exempt from licensing. And there's some states that exempt as many as 4, 5, 6, 7 kids. That means you're talking about family childcare homes who are serving several children who are in that license exempt category. So it's really important to understand that Colorado's reality is probably that 4th bar, the 3rd or the 4th bar, but there's states on both sides. So the second thing I want to do as context is who uses these providers, and nationwide research suggests that these providers disproportionately care for a lot of children of families who face really structural barriers to accessing resources in childcare. And this includes families with infants and toddlers, children with disabilities, children from immigrant families, families who have particular challenges affording childcare, families working non-traditional hours. There's a stereotype out there that these providers are the care of last resort. It's like the families don't want it, but they have to use it. That's simply not true. It's true in some cases. But we, for example, talked to families working non-traditional hours who wanted their child in their own home with somebody they trusted to be taking care of them so they could go to sleep in their own bed at night if they had to work. They didn't want their child necessarily in a licensed program. So children with disabilities, sometimes the best person to care for them is somebody who knows them well, a relative, maybe also the only person who will take care of them, right? So thinking through that this is not just what parents have to use. Many parents may want this. You may want to have a provider who actually speaks your language so that you can know what's happening to your baby if they were not well during the day. So the last thing, and this is, I'll be doing this for some folks who may not be aware of the CACFP. The CACFP is a program that's focus is to support the nutrition of children who are not in the care of their parents. If you think about the school lunch program that does this for schools, this is kind of the equivalent for childcare settings. I want to stress from my perspective that this is a child nutrition program. It is not a childcare program. It is not paying people to care for children. It is paying for the food that children need while they are being cared for. Childcare is the setting, the same way schools are the setting. The CACFP helps pay for some or all of the costs of nutrition meals for children in childcare settings. They paid for almost 1.8 billion meals in childcare in 2022. And participating has been shown to be associated with a range of benefits, including a reduction in household food insecurity. This is a federal entitlement program, which means that anybody who meets and complies with program requirements can participate. So if you are eligible and you do what the program tells you to do, you can participate in the program. Oops, there's 2 tiers of rates. This is a little in the weeds here, but tier 1, if you are a provider who's low income yourself, you're in a low income area, or you serve children who are low income. For those individual kids, you get one rate. The numbers are here. Tier 2 is for everybody else. So it's $1.65 for breakfast, $3.12 for lunch and dinner. This is this current school year. It is usually run by the state departments of education or human services. In Colorado, it's actually run by the Colorado Department of Public Health and Environment. In this program, basically home-based childcare programs work with what they call sponsor agencies, who are responsible for recruiting, enrolling, training, monitoring compliance, collecting information on meals that are provided, and managing the payments to the providers. So the sponsor agency is a really critical factor. And those sponsor agencies receive a set amount of reimbursement from the Child and Adult Care Food Program to cover the administrative costs of doing those activities. What do we know about this program and those providers, the two groups I just told you about? One is we know very little. So I would say our findings have changed over the time of doing the study. So we're still in the process of discovery, but it appears that relatively few states allow licensed exempt providers to be eligible for CFP. This number seems to be growing every day. So we first thought there were 6, and then we thought there were 8, and then we thought there were 10. This is the list of states: California, Colorado, Illinois, Louisiana, New Mexico, New York, Oregon, Tennessee, and Washington. There's probably some more out there. We're hearing more and more each day about states that allow this. We're very unclear whether or not they actually do it, right? So allowing it does not necessarily mean that they have folks participating, but we don't know. But what we found in doing this work is that states have a lot of discretion in determining, if you're not relying on licensing to be the approval mechanism to make sure that a provider is approved, states have a lot of discretion in defining what an acceptable care environment is for those settings like license exempt home-based care that don't require licensing. So this can range from on-site inspections by licensing or approval officials to simply reviewing a self-certification checklist. And I'll talk a little bit more about some of the options out there. So the states have a lot of latitude in how they choose to approve license exempt providers. From what we can tell, again, we're still figuring this out, most of the states that do this limit the food program to those providers who are approved for the subsidy, childcare subsidy program. In Colorado, that's the CCAP. But this is the program that's funded by the Federal Child Care and Development Fund, or CCDF. So that's what happens in Colorado, and I think you all call the providers who are approved by CCAP are called, I think, qualified exempt in Colorado. Every state has a different word for it. So, but that's what you all call it. But we did find, and again, Tabor actually found us recently, another state that we hadn't heard of. So we now know of 3 states that have alternative approval processes that do not require the subsidy program to be the approval process. Louisiana, which we'll talk more about in a minute, requires fire marshal approval. California requires providers to be approved by their Trust Line project, which is a criminal background check and a self-certification checklist. And Tennessee, from what we are just learning, appears that sponsors assess whether or not providers meet a basic health and safety checklist that the state has established. We're still learning about that. We just discovered that one last week, or Tabor discovered it and shared it with us last week. So what did we learn from this study? First of all, in all 3 of our states, there was a really strong value, but not necessarily priority for these providers. So the respondents pretty uniformly said that it's really a good thing to do to support these providers. It supports children's access to healthy food. It builds, okay, I think Alejandro, are you asking me to slow down? I will slow down. I think that's
Gina, can you hear me?
Yeah.
Yeah. Hey, sorry, it actually seems like it zoomed threw me off for a second. So if we can go just repeat a little bit go back to the last slide.
This slide or the one before that?
Yes, this one. If you can go over this one more time.
Sure.
I'm sorry, I wasn't able to capture that. Thank you.
No problem. Thank you for raising your hand. I really appreciate that. No problem at all. So this slide is focusing on what do we know now that I've described what CACFP is and what I've described about what we know about licensed exempt providers. What do we know about how they fit together? And what we talked about a minute ago is we don't know very much. But of those states that do it, most appear to limit it to those providers who are approved by the state subsidy system. And that's funded by what we call the Child Care and Development Fund at the federal level, or CCDF. In Colorado, this is what you all do. You limit child and adult care food to those providers who are approved by the Colorado Child Care Assistance Program, or CCAP, which is the program that's funded by the CCDF, just to have lots of initials throwing around. And you all call them qualified exempt providers. So that's the subset of FFN providers who go through the approval process for CCDF and can get CCDF. Colorado allows those providers to get the food program. A few states, however, have alternative strategies. And as I mentioned minutes ago, we're still learning about this. Louisiana requires fire marshal approval. California has what they call trust line, which is a criminal background check. So a provider has to be approved by a criminal background check and a self-certification checklist. And in Tennessee, we just heard about this recently. It appears that sponsors are responsible for assessing whether or not a provider meets a health and safety checklist that the state has established as being their criteria for approval. So these are 3 of the states that we know have these alternative strategies. So what did we learn? First of all, these providers are valued but not prioritized necessarily. The benefits were really clear. Supported kids' access to food, built providers' knowledge about good nutrition, which they said not only affected those kids, but the providers' families and any other families they worked with. Reduces the financial burden on providers, which is a big deal given how really cash-strapped many FFN providers are. Improves the health and safety of the care environment, and it can reach children who otherwise would not get support. I want to add something here that's not on the slide. Many folks said these providers are going to be serving these children anyway. These children are going to be in care. The question is whether we can get food to them while they're in care, right? It's not like the providers taking care of the children to get this money. They're taking care of the children, and the question is whether the assistance is going to help. But in Illinois and Oregon, and I'll explain why in a minute, they said that while these providers were valued, not all the sponsors prioritized them because it was really hard, challenging-wise and funding-wise, which I'll explain why in a minute. Those 2 states talked about that. What we found is that these states had fundamentally different approaches. First of all, Illinois and Oregon, as I mentioned, they rely on the CCDF, the subsidy program approval, like Colorado does. Louisiana is one of the alternative states that has the fire marshal approval. What we found is this has really major barriers for who can get in and how likely they are to stay in. So if you think this is similar to Colorado, for Illinois and Oregon, I'm just going to walk you through the process. First of all, for both Illinois and Oregon, these providers are serving 3 or fewer kids. The first step is the parent has to need, want, and be able to get a subsidy, which means they need paid care. They need to be working or meet any other requirements for CCDF. They have to be income eligible, and they have to have a child who is a citizen. Those are all requirements established by the child care subsidy program at the federal level for the program. So if you think about those yellow bars, it already takes us just down to that dark yellow group, the smaller group, because those are the folks who are using paid providers. If you don't pay somebody, you're not going to need child care assistance to help pay for them, right? And then that parent has to be able to successfully navigate the application process for CCDF and to be approved. But nationwide, we only have enough money to serve about 15% of those eligible under federal law. So you can see that even on the parent side, it's getting to be a pretty small group. And then second, the provider has to be willing to meet the CCDF approval standards, which is a comprehensive criminal background check for all adults in the household who might come into contact with the children, home inspections, trainings. The states we talk to require social security cards. So there's another set of constraints. So the parent jumps through those hoops, can get it, then the provider has to jump through hoops to get it. Once that happens, then that child care agency notifies the food program that these providers have been approved and they can reach out to them for assistance. My guess is that might be similar to what's happening in Colorado. We did not study Colorado, so I don't know. In contrast, in Louisiana, first of all, Louisiana is much bigger. They're in that chart of where states fell. They're way over on the right-hand side. They exempt homes serving less than 7 children. So, and anything over 7 children is licensed as a center. It's a very unusual state. But that means that for them, licensed exempt home-based care is a huge part of their home-based market. And they only require the sponsor agencies do some outreach, but it's word of mouth, because what happens is that they have to meet a fire marshal inspection. So the sponsor agency helps the provider prepare for a fire marshal inspection. It's basic health and safety rules that have been established for CACFP to kind of be able to be accessible for providers who are very poor, but still ensure some basic health and safety. The fire marshal inspects the home, and then as soon as they pass, the sponsors enroll the provider. In those yellow bars, all of the yellow, the light and the dark in Louisiana are eligible for CACFP if they go through this. So all of those yellow that are not paid, also able to get food. So this is the only program that, if you decouple from CCDF, what you find is that the whole population of children are suddenly able to access this program in theory. So bottom line, in Oregon and Illinois, much smaller sector is potentially eligible. Only those who are paid. People get CCDF. Providers who are willing to meet those requirements. In Louisiana, it's paid and unpaid. This is very hard to see. I know that, but I decided to put it in because the yellow is on the left, and it just shows you each of the steps that winnows down. If you have all these providers who might be eligible, who winnows down and down and down and down, who actually can get it. And then in Louisiana, you can see that it's pretty much everybody that started in it. All you have to do is do the fire marshal, which certainly winnows out some folks, and help getting them. So just, there's a lot of information on this. I don't want to go through the details, but just to tell you, that's basically what this slide is trying to show. I know it's also very small print. So on both, all of these states have the same CACFP enrollment process. It's just set by CACFP policy. There's relatively little variation. They meet with the provider. Sponsor agency meets with the provider, helps them understand the rules, the paperwork requirements, the monitoring expectations, reporting systems. Sponsors have some discretion in what kind of help they give to providers to help them enroll. Not a huge amount, but they have some. We did hear that respondents found that some providers just said that the financial nutritional benefits of the program were simply not worth the burden of jumping through all those hoops. So this is something to flag for you, is that the CACFP enrollment process also has some challenges for providers. We also found that these providers face some real barriers to stable participation once they're enrolled. Some of this is due to the requirements of CACFP. The reimbursements are pretty low. As I just mentioned, the paperwork and reporting burden can be quite high. You do have to have unannounced visits, which some, particularly like small home-based providers or relatives, don't particularly want somebody coming into their house. And to be honest, the requirements are really designed for programs. They're not necessarily designed for grandma taking care of 2 grandchildren, right? So, for example, you need to be letting the agency know if you're going to be out of the house during a meal in case that's when they want to do an unannounced visit. Grandma is not necessarily going to think about calling the agency to say, oh, I'm taking the kids out. It's a beautiful day. I'm taking the kids out to the park for lunch, to have a picnic, right? That's not necessarily, you don't necessarily think of that. So, but in Illinois and Oregon, we found additional barriers to being able to stay in the program, which is, even though it's not necessary, they not only tied entry eligibility for CACFP to participating in CCDF, but they also meant that if the child left CCDF, at some point the provider was going to lose CACFP. Completely unnecessary, because in licensing, we license them for a year. You don't necessarily have to say that that particular child who apparently jumped through all those hoops, still has to be able to get it. Both states, I think, had given some leeway, like you had a couple of months to get another child in, but there really was no need. So the ongoing meant that what you had is a lot of turnover potentially. We heard much more about turnover in these 2 states than we heard about Louisiana. Louisiana didn't really raise it as an issue. They said that first couple of months can be tricky, but once people are in, they stay in. But the ongoing eligibility for CACFP being tied to CCDF in states that do that was a challenge. We also found some higher barriers to enrollment and retention for some providers than others. These are not going to be surprising to anybody. Providers who speak a language other than English, providers with low literacy levels, providers living in rural areas, providers who are not experienced with technology, and providers who are immigrants from immigrant communities or providers of color. All of these groups, the sponsor agencies described, if you think about it, the sponsor agency has a certain amount of money. If you're having to work with somebody that everything has to be translated, that's going to take longer. You work with somebody in a rural area, that's going to take longer for you to drive out there and do the inspections. If somebody doesn't have technology, it's going to take longer to figure out how to do. If you get a set administrative payment for every provider, that's a real disincentive to be able to serve the providers who may need extra support. But this has real equity implications for which children can access food program. We also found, and I just alluded to this, that the sponsor agencies face real challenges. And I think it's really important to acknowledge that. First of all, many of these providers are not used to dealing with public agencies, so they can be more intensive to support. You have to figure out who they are. If they're not identified by the CCDF agency, you may have to support them on technology and paperwork and all those things I just mentioned, right? So they may not have a computer. They may not have an online presence. They have to figure out how to do reporting forms. So it can be more challenging. Because of what I mentioned of the connection to CCDF and the challenges and the low rates, create higher turnover rates, which makes the cost harder for the provider because for the sponsor agency, because they've invested all the money to get the provider in, but then they don't stay in. So they don't actually get any of the money to be serving them on an ongoing basis, right? So the high turnover rate can be a real disincentive. We're not exactly clear how much of this is because of the tie to CCDF, to the subsidy system. We think some of it is, probably some of it's also it's a CCFP is a hard program, but certainly the CCDF tie makes that worse. And then finally, as I just mentioned, the financing and rate structure of the CACFP doesn't really support sponsor agencies to do the extra that they need to do. So what we found is some sponsor agencies would get resources from other places, like they were partnering or they got resources from a foundation or something that allowed them to do the extra work to make this happen. But CACFP by itself is not as likely to do that. One exception is this rate is flat for sponsor agencies all across the country, and it's the same. So in rural areas where costs are low, it takes you further than it might if you're in inner city New York or Chicago, right? So you think about there might be some issues here in Colorado. Cost of living in some parts of the state might be a little lower, but it is a challenge. So quickly, policy implications. Several things that we identified that could really help expand participation. One is to help people understand the value of these providers and the number of children that are using them and the impact that we could have on their nutrition and their development if we figured out ways of supporting them. Again, I go back to those yellow bars. I don't think people understand how many children are in these settings. Now, some of those kids would be like, if my daughter has a baby, I'm going to want to help take care of that baby, right? Some of you people like me, but a lot of them aren't, right? So thinking through, like, how do we help people understand that yellow bar, that whole yellow bar is a lot of children who are vulnerable to food insecurity who we should be helping. Second, I really encourage us to focus on what matters about prioritizing child nutrition goals. Not to say we don't care about the health and safety of children, but what's happened in the past, people say, oh, we need to require them to be licensed because that will give an incentive to people to become licensed. Well, that's a childcare goal. And grandma probably never wants to be licensed, right? So we've let the goal of licensing, a childcare goal, kind of undercut the focus of, like, can we get food into this child's mouth so that they can develop in a healthy way? So this is what I'm saying about prioritize child nutrition goals. Certainly think about health and safety. I'm not saying ignore that, but don't try to make this a childcare agenda. Take some steps to open the door to these providers. One is to use the flexibility of the federal program to make a much broader range of these providers eligible. Encourage states to establish alternative approval standards, not tying it to CCDF. And then the state gets to decide what they think is essential for accountability in funding for nutrition assistance. Because you obviously have to have some accountability. You're not supposed to hand it out to anybody. But the state should be deciding, not the federal government. CCDF rules should not be determining what accountability means, right? And so first step, open the door. And the second step is help providers walk through that door and stay in the program. And that means we have to support sponsors and partners to incentivize and facilitate outreach and recruitment through trusted partners and navigators and mentors. We need to figure out ways of stabilizing their enrollment. If it's linked to CCDF, decouple it from CCDF for ongoing eligibility. And think about how to help give sponsor agencies the resources to do this, whether it's materials, extra funding for navigators, whatever it may be, because they are not necessarily supported through the existing CACFP structure. Really focus on equity and access for underserved populations. So if you develop resources for sponsor agencies, think about having them in other languages. Think about how we're going to provide maybe you have an internet broadband initiative. Make sure that these providers are part of that so they can access the internet, whatever you can think about to help minimize those barriers. And then finally, I think this is a national question. We really just need to look at the program overall and really think about the participation barriers, because it's a challenging program. There are many licensed programs who find it challenging to participate. It's going to be particularly challenging for this population. So that's not a Colorado agenda, that's a national agenda. But I think it's an important one for us to recognize that taking a program that's designed for a childcare center and asking a grandmother to meet it doesn't make a whole lot of sense. But that's a federal situation. So in conclusion, this is a huge opportunity, I think, to help many, many, many children get food supports, simplifying eligibility, helping providers actually get the program, supporting sponsor agencies and making it happen. And this really could have a big impact on making nutritional supports available to the millions of kids vulnerable to food insecurity. And very importantly, it could alleviate the financial hardship for licensed exempt providers who are feeding these children, often out of their own pockets. So, and it's often very poor folks. So if you figure out a way of giving them a little bit more resources that they can be not trying to sacrifice their own needs for the children, that's important. So I'm going to stop there. We'll send this out. These are the reports, just so to say, we have a big report, a little report, a 2-page fact sheet, and a blog. So any size you want, any density of information, you can get the 80-page, the 20-page, the 2-page, and the very short. So these are all the links to that. And we also did a paper a while ago on the similar issues. So I will stop sharing and open it up for questions.
Thank you so much, Gina. I learned so much every time by engaging in this work, and that was an incredible presentation, and thanks for providing that. So thanks everyone for being here. If you do have questions, feel free to put them in the chat. We'd love to have the rest of this meeting today be some discussions if you're having questions come up. And we had a couple already and then a couple sent to us before, so we'll just start with those and I'll read them out. So please do put any additional questions in the chat. The first question, and Gina, I don't know if you are going to know this one, but if somebody else on the call does know it, please feel free to unmute yourself. It is, do sponsor agencies have to be public entities, or can community-based organizations serve as sponsor agencies?
I believe they can be. They just have to go through the full approval process to be a sponsor agency, which is not necessarily very simple. I do think there's CACFP experts on the call who can provide information about that. But I do think one of the interesting questions to explore is, could that happen? Could there be partnerships? For example, I understand that there's a home visiting program in Colorado that works with FFN providers. Is there a partnership that could be between that provider, those folks who are already going into providers' homes, and a sponsor agency? I think there's some interesting things to explore, but I do think that the sponsor agency role is a contractual relationship of an agency that's actually administering a federal program. So that certainly has hoops jumps through it. I don't know if anybody else on the call wants to answer that any more quickly.
Hey, Bert, it's Naomi. Hello, I'm on the call.
Thank you.
Oh, good.
Hi, everybody. I am the Child and Adult Care Food Program Director at the Department of Public Health and Environment. And I developed a cold a couple weeks ago, and it's just like not going away. So I'm sorry I sound nasally, but I feel a lot better than I sound. But to answer the question, the organization needs to be a tax exempt organization. And then if an organization is interested in applying to become a family daycare home sponsor, they would reach out to the Department of Public Health and complete a family daycare home proposal. In Colorado, we have 4 family daycare home sponsors that serve statewide. And we also have 3 military family daycare home sponsors. And in Colorado, we work very closely, providing lots of support to our daycare home sponsors. But if somebody wants to learn more about how to become a sponsor, they can contact me at CDPG, and I'm happy to put my contact info in the chat.
That would be great. Thank you. Gina, a question that came in prior to this call that I just want to highlight, and you talked about it a little bit, there are folks who are concerned about ensuring adequate health and safety in license exempt settings. What would you say about sort of this decoupling and the health and safety and the food piece?
I think it's a really important question, and I do not want to suggest that we should be handing money out to complete strangers on the street for 2 reasons. One is you care about the kids, and second of all, you have a fiduciary responsibility to make sure the money is being spent appropriately, which CCCAP is pretty good at doing. I think this is a question that states can take on themselves, and this is why I think Tennessee and California and Louisiana are really interesting. Each of them has said, we don't want to do CCDF. we think that this is what we think is a baseline. So in Louisiana, I think the fire marshal thing is very hard to put in place at this point. They've had this program in place for decades in Louisiana, so it's long established. But they came up and said, okay, we have many people in rural Louisiana taking care of children who may live in a trailer home and maybe live in a, all sorts of kinds of options. How can we assure basic health and safety and ensure that those folks can participate? So they came up with standards, and they also have money to available to help the programs get that grandmother get the fire, extinguisher or the whatever it is, right? But they came up with what they thought made sense for their population, that made them feel this is safe enough, because this is a food program. Again, full licensing around curriculum and teacher training, all those things. That's childcare. This is about, what do you as a state feel is a minimum accountability that you want to have with how these funds are spent? So California said criminal background check and a self-certification checklist. What we think we've learned in Tennessee is that they came up with their health and safety checklist that sponsor agencies put in place. So it is important to do something, but what that it is, I think, is if you're not going to use the federal CCDF rules, which are childcare rules, they are not child nutrition rules, they are childcare rules. What do you think would need to be in place? So not saying not to have them, saying I think this is a really important conversation to think about what accountability and protection means within the context of giving people money to feed children.
Thank you. Another question that's coming up is, what is the financial benefit to being a sponsor, and how do we encourage more organizations to be sponsor agencies?
I'm going to ask Naomi to answer that question, because I want to be honest and say we came into this project as childcare people and are learning quickly about CACFP ourselves. But luckily we have Naomi and others on the call who actually know childcare and the CACFP program and can answer that. So Naomi, do you want to answer that one for us? Do you mind being honorary expert here?
Absolutely, and it's good to see you again, Gina. We met a few weeks ago when you presented at Roundtable.
Yes.
And I know I have other colleagues on the call, so feel free to chime in if I missed something. But, what we hear from our family childcare home sponsors is, meeting the bottom line, or being a sustainable organization can be tough. As Gina mentioned, the reimbursement doesn't always cover the cost. So for example, over the last few years, we've seen gas prices go up, and our family daycare home sponsors are required to visit home providers 3 times a year minimum. And so that could mean that a sponsor located in Centennial needs to travel to the Western Slope, and they might be doing an unannounced visit, but someone's not there. The home provider's not there or didn't notify. So the home sponsor would have to go back. And what we're hearing from them is the increase in costs to travel, to stay at a hotel, continues to rise, just like food costs. We're all feeling it, I think, in our own pocket. Prices of everything is going up. So our family childcare home sponsors are dedicated, but they do express concerns about being able to maintain that sustainability with the current reimbursement from USDA. And of course, we pass this information on to our partners at the federal level. And this is not single to Colorado. This is a nationwide concern. Gina, I'm not sure if you've heard that, but I saw you nod your head. I hope that answers the question, but I'm happy to elaborate more if you would like me to.
If I can just add the other thing, and Naomi, I'll just apologize. I was trying to get the links for you guys. I lost track a little bit of what you said. One of the issues that we're also facing nationwide is there's been a real decline in the licensed family childcare world. What's interesting is that there, as far as I can tell, there's not been a decline in this license exempt world. So one of the questions is, to me, is if we could make this license exempt group more doable for sponsor agencies, it could be a way of bolstering their caseloads, because their caseloads have been going down, down, down. If they've been focusing on family childcare, licensed family childcare. So it's not a quick fix, because there's the big if there of how do you make this more financially feasible. But I do think it's interesting to know that the challenge they're facing is that their other group of eligible providers is declining and has been for quite a while.
Yeah, Gina, and I think we could probably go on and on about some barriers that might exist, but something else we're hearing in Colorado is this is both licensed centers and home, is providers have a lot to manage. They're providing care, they're meeting licensing regulation. And CACFP in Colorado is a choice. So sometimes our providers are like, that sounds great. We know we need to meet nutrition requirements as outlined in the state, but the, recording of meals or the documentation they would have to do in the home, they might just choose not to do it right now. It's one more thing to manage. And I think we can all relate to that some days in our work life or even personal life. It's like, do I have to do this right now? If I don't have to do it, then I'm going to postpone. But again, I'm sure a lot of you on the call have heard from childcare providers and the different barriers that come up. But I do want to emphasize that we at the Department of Public Health and Environment, the team, we are committed to, when we hear about those barriers, try to do something about it, but sometimes federal requirements prevent us from doing something otherwise. And I hope that makes sense to the group.
I appreciate that, Naomi. I just want to say, I think one of the things that I've been getting more and more a sense of is that part of what really is necessary is a partnership between agencies like yours and outside groups can bring some more resources in to help, because I do think the federal limitations on funding, on the rates, supports, et cetera, really just create a challenge that until that's changed on the federal level, that's a constraint that the CACFP agency is going to face. But thinking through what partnerships, what outside resources can come in, what could do, for example, if there's really strong FFN communities, if it gets, the CCDF link in Colorado, honestly, is a challenge, because there's very few providers who go through the CCDF approval process and then are going to get into the CACFP approval. I gather that's something that's under debate, but decoupling it allows much more flexibility for being able to reach out using the networks you have, thinking about, is there a strong FFN network already that's supporting providers? Can we figure out a way of really providing some navigation support, helping them understand how do you fill out that paperwork? How do you make all of those things less of a burden? That's the kind of thing that I think, depending on where the state is, and if there's ways of thinking about how can you facilitate it no matter where you are or what your structure is. It's just some of them are more open than others. But I think partnerships between agencies and outside orgs that have similar goals, just recognize the constraints that the agency is under, could be a really important way of moving forward. And in Colorado, my sense is you all have a pretty strong set of folks interested in this community, which is not true for all other states. So I just want to flag that I think probably on this call are a lot of resources of folks who are very closely, I can see some on my screen right now, are very closely tied to FFN providers and understanding how to work with them. So
Yes, you are so
and
correct, Gina. Tabor, if I could just make one comment before passing it to Tabor.
Yes.
There is a lot of cross collaboration going on in Colorado between state agencies, between partners who support qualified exempt, license exempt, or FFN. I would say more so than ever in the past 2+ years, we are trying to make those connections. And Colorado's really proud. Last summer, in partnership with Department of Early Childhood, many Donald K, Nourish Colorado, many partnering organizations who helped us expand eligibility. I think it's important to understand that up until about 1.5 years ago, guidance from our federal partners was a little bit different than what we learned last year. And what we learned last year is we identified qualified exempt CCAP, as you spoke about earlier, Gina, that they are considered approved by the licensing agency and therefore eligible to participate in a CACFP. For those on this call, I want you to know that we will continue to explore expanding eligibilities. This is not the first time we've talked to Gina. We're talking to other states. So we're just because we expanded eligibility doesn't mean it's one and done. We want to continue to explore opportunities.
Thanks for that. This is really helpful to have you on, Naomi, and be able to have this conversation in real time about how this could really become a reality in Colorado too. Another question coming in, there's been 2 around sort of citizenship requirements when we're looking at supporting FFN providers. Is there work on supporting providers who do not have a social security number or ITN? And I think that relates to if, especially in Colorado, if a qualified exempt provider has to get CCAP funding and have a social security card, how does this sort of relate to being able to get food benefits without having access to social security number or ITN?
Can I just say something? There is no federal requirement that I'm aware of that says that a provider has to have a social security card. There's nothing in the rules about the federal rules about the citizenship status of the provider. The child has to be citizen, but even the child's parents don't have to be. So I just want to flag that if there is an SSN number requirement in the CCDF rules, that's a state decision. And I don't know that there's any federal requirement that you have to have a citizenship status to get CACFP. The state does have to have something that allows them to pay you, right? And I presume that there's some certain requirements around the payment process, but I don't know of anything that says that a social security number or citizenship is required. Now, Naomi, if you could just put into chat, because I imagine we're outweighing your voice at this point, if that is different in Colorado, or if you think I'm wrong, that would be really helpful. But I think on the CCDF side, it's a state decision, and on CACFP, I've not seen anything that suggests that it should be, other than what the state says is needed to get paid.
As far as I know, I don't think a social security card or number needs to be made available, but that determination or procedure is under the Department of Early Childhood. So Department of Early Childhood tells CACFP who has been licensed or qualified exempt. And then our CCCAP staff work with our home sponsors to let them know who is eligible to participate. And from there, our home sponsors do outreach. So that question would be better answered by Department of Early Childhood.
That's great. Why don't
and
we
let me just say quickly, respond to Christina, is just to make sure that it's clear that it is the I agree that it's not fair. A subsidy program is the only thing that's limited to citizen children. We don't think the food program is. That's just to be clear about what program I'm talking about. The subsidy program under federal law, we had a great victory when we got them to say that it did not serve as a public welfare benefit, in which case the child would not, and the parents would have to be citizens, but it's counted as education, which allows the children to get it if they're citizens. So anyway, and there's no citizen requirements for CACFP. So that should not be an issue. According to Jerry Henchy, who's from FRAC, the Food Research and Action Campaign, who knows everything there is to know about CACFP as well. So back to you, Deborah.
Thank you. That's very helpful. And in our follow-up, we can also send a resource about that and do a little bit more digging with the Office of Early Childhood. A question here, I'm curious how often licensed centers who accept CCAP or the CCDF program are able to overcome the barriers of accessing CACFP? Are we doing a good job of reaching those children already?
Nationwide, I can answer, and I'll let Naomi answer for Colorado. Usually centers have somebody who's used to dealing with paperwork. They usually have computers. They usually have a lot of that stuff. They're used to dealing with forms. So it's not as much of a barrier as it is for the small family homes. So Naomi, do you want to respond more clearly about how you see that playing out in Colorado?
Yeah, so prior to expanding eligibility, we worked closely with Department of Early Childhood, many partners on this call, in a quality nutrition work group that was started by the Preschool Development Grant. And that work group continues. When we received confirmation that we could expand eligibility, we worked with several partners to identify opportunities to spread the word about expanding eligibility. Our home providers, as I mentioned, receive data from us through Department of Early Childhood on who is licensed or qualified exempt. And they do reach out and make contact. The sign-on has to be in person, so the home sponsor visits the provider to talk about the requirements and how they can provide support. So there are a lot of strategies. Are there more opportunities? Yes, and we continue to explore those further. If you have ideas, I have written communication I can share with this group to help spread the word about CACFP.
That'd be great. Thank you. Our last question, and then we only have a couple minutes left, and I don't know how quick this question can be, but if providers are not required to have a Social Security number, how does that affect payment and application for providers? How would they get paid for this program if they don't have any identification?
In Colorado, the home sponsor is not asking for the Social Security. They're going to ask for a bank account routing number where to deposit their reimbursement for meals served.
Got it. Thank you. It's been really helpful. Okay, in closing, Gina, thank you so much. Fernando, Catherine, for your amazing report. We've all learned so much today, and please write more reports like that. Thank you for providing so many amazing resources, and it's made a difference in our state for sure. We'll be emailing out slides from this and the couple questions that came in that we'll do a little digging in with CDEC around requirements for receiving CACFP. And if you're interested in this topic, please keep an eye out for a sign-up link in the follow-up email, and it'll help you stay in the loop around efforts to improve nutrition access for kids in Colorado. And just drawing some attention to any final comments in the chat here, I wanted to note that Colorado Parent Coalition has a link in there if you'd like to learn more about work they're doing, as well as the Food Bank of the Rockies is a CACFP sponsor, and if you have questions around that, please reach out to them as well. So look at the chat before we close here, and thank you all so much for joining today. We're so excited to have this movement in Colorado, and we'll stay on till everyone closes out. And thank you again for coming, and hope to have more of these, and we'll continue inviting folks. So thanks for showing up. We know how busy everybody is.
And congratulations, Colorado, for taking this on. It's so exciting to watch you all thinking seriously about this and making a priority. So kudos to all of you. Well done. So
thank you, Gina. Just also want to thank Alejandro, our interpreter, for today.
Yes.
Thank you for your work. We appreciate you.
Thanks so
Bye-bye.
much. Bye-bye.